the Synovus MCA GEM flow coupler device and system. Introduction. The flow coupler system consists of a flow coupler device and a flow coupler monitor. The flow coupler device includes a 20 MHz ultrasonic Doppler transducer or probe attached to one of the flow coupler rings and an external lead. Instructions. End-to-end anastomosis. The procedure for using the flow coupler is the same as that of the coupler device. After matching of indicator arrows between the anastomotic instrument and the flow coupler has been verified by an audible click, verify probe function by connecting the probe to the monitor and irrigating the attached probe tip with sterile saline solution. An audible signal from the monitor verifies proper function of the device. Visually inspect to confirm that both rings are seated at the bottom of the U portion of the jaw and that the pins are not bent. If the pins are bent, do not attempt to straighten them. Instead, use a new flow coupler device. Note: to avoid unwanted kinking or twisting of the vessel during positioning of the flap, care should be taken to establish the desired angle of the probe wire relative to the flap and to adjust the anastomotic instrument accordingly before starting the anastomosis. To complete the procedure, follow the steps provided for the 3.0 mm coupler size end-to-end anastomosis technique. Take a bite of approximately 1 to 2 pin diameters of the vessel wall and intimal lining, evert 90 degrees, and impale onto one pin. Proceeding in a triangular fashion, impale the vessel firmly onto every other pin, completing 3 pins. Complete vessel placement on the ring by impaling the vessel onto the remaining 3 intermediate pins. Ensure that both the vessel wall and the intimal layer are fully impaled on each pin to reduce the risk of thrombosis. Repeat steps to impale the other vessel end on the second coupler ring. When both vessel ends have been suitably impaled, visually inspect to ensure that both rings are seated at the bottom of the U portion of the jaw. Bring the rings together by turning the anastomotic instrument knob clockwise. Before ejecting the joined rings, gently squeeze the end of the opposed jaws with a small hemostat to ensure ring approximation and a tight friction fit. Turn the anastomotic instrument knob further clockwise to eject the joined rings. Check the anastomosis under the operating microscope before opening the vascular clamps. To remove the jaw assembly, turn the anastomotic instrument knob fully counterclockwise. Press the release button, located near the arrow on the anastomotic instrument, and remove the jaw assembly. Flow detection. Before closing the surgical site, verify that blood flow is detected. Temporarily secure the probe wire to the skin to prevent the weight of the metal connectors from pulling on the probe. Join the probe connector to either end of the external lead. Attach the other end of the external lead to the flow coupler monitor. Select the appropriate channel on the flow coupler monitor and listen for blood flow. Adjust the volume as needed. If a strong audible signal is not identified, irrigate the anastomotic site with saline solution. During irrigation, an audible signal from the monitor verifies proper function of the device. Carefully position the probe wire to leave enough wire length in the wound, providing slack to ensure that there is no tension on the anastomosis. Ensure wire is not looped under skin. Once satisfied with the wire placement, use a tack suture on the probe wire at the wound margin. Secure the suture sleeve to the skin with suture, tape, or staples. Ensure adequate slack in the wire. After the probe function and wire placement are verified, close the incision using standard techniques. Cover the exposed probe wire with medical dressing. Blood flow can be detected for up to 7 days as needed. The probe is not intended to be a permanent implant and should be removed 3 to 14 days postoperatively. When monitoring is not performed to detect blood flow, the external lead may be disconnected from the probe by pulling the probe connectors apart. If blood flow is not detected with the monitor postoperatively, rely on clinical indications for patient status. To remove the probe, first detach the suture sleeve and wire from the skin by removing the suture, tape, or staple. Remove the probe by applying gentle traction to the wire at the site of the incision until the probe is extracted. With visual inspection, confirm that the probe is fully intact. If the probe is not present, surgical removal is required. Service. For customer or technical service, please use the following contact information. For more information, please contact Synovus Micro Companies Alliance or visit our website at www.synovusmicro.com. Synovus Micro Companies Alliance, the microsurgeon's trusted resource.